Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Bacterial vaginosis. In bacterial recurrent candidiasis. In recurrent candidiasis, there will be more than, if there are more than or equal to 4 episodes of candidiasis in a year, then we call it as recurrent candidiasis. Treatment of recurrent candidiasis: oral fluconazole is given in 150 milligrams on day 1, 4 and 7. Maintenance dose of 150 milligrams weekly can be given for 6 months in recurrent candidiasis.
So in recurrent candidiasis, oral fluconazole is given 150 milligrams on day 4 and 7, and also same oral fluconazole 150 milligrams is given weekly for 6 months as maintenance doses.
thank you and thank you for watching.